Hello, welcome to another episode of the Wicked Feminist Podcast. And today we have an exciting episode for you. We will be talking about gynecological health and we'll be focusing on just two major concerns: cervical cancer and ovarian cancer. Then I have an amazing guest with us today. Her name is Aima. Aima, over to you.
Hi, my name is Aima. I go by It's the Queen or Dream Girl on Twitter, and it's nice to be here.
Thank you. It's so nice to have you on the show too. So Aima, can you walk us through what gynecological health is and what is gynecology and what difference does it have with obstetrics?
First, gynecology is the study of the female reproductive treatment, how to properly care for it and treat its diseases.
Okay.
And its health obviously has to do with it being in a good condition, keeping it well maintained and in a good condition, and that has to do with you knowing your body, going to your doctor and all that stuff. The difference between gynecology and obstetrics is obstetrics deals more with the reproduction part. So the childbirth, pregnancy, delivery, diseases having more to do with childbirth, like ectopic pregnancies and what's the other thing? All the other things that come with childbirth, diabetics, gestational diabetics and all that. But gynecology deals strictly with the diseases of the sexual part of the sexual reproductive system, like the vagina, the uterus, the cervix. Those are what's most important.
Okay, thank you. Okay, so can you walk us through or shed more light on ovarian and cervical cancer? Or before that, please, can you tell us what gynecological problems are? And can you give us examples? Because we're just talking about two today, but I want the listeners to know other gynecological disorders.
So gynecological disorders have to do with the diseases and the cancer. So you'll find a lot of infections, things like yeast infections, sexual transmitted diseases and things like that. You'll also find the cancers, the ovarian cancers, the uterine cancers, the even vaginal cancer and cervical cancer. There are the malignant ones, and then there are benign tumors like fibroids and other important things. Things like UTIs are also very common, urinary tract infections, and things like that. Also, it's very common for women to come in with urinary incontinence, like after childbirth, or weak pelvic floors. Those gynecologists can also deal with.
Thank you. Okay, so let's talk about ovarian and cervical cancer.
Which do you want to start with?
Let's start with ovarian cancer.
Ovarian cancer is one of those cancers. They're very tricky, and they have the tendency to become malignant, and that malignancy is bad. I don't know. Let me kind of explain malignancy. Benign is good. So benign, it won't really turn into cancer. You can just take it out. While malignant is bad, it spreads. It'll, metastasize and spread to other parts of the body through the lymph nodes. We do not want that through the lymph nodes or the blood or directly. We do not want that. But ovarian cancer is very tricky because 25% of them will become malignant. So 1 out of every 4 women will have malignant ovarian cancer, those that do get ovarian cancer. And they're asymptomatic in the early stages, asymptomatic and painless. They won't even affect your period. You'll just be going on your own. Then you won't even know it's there. The only telltale sign is that is enlargement of the abdomen, because the ovaries, I don't know if you've ever looked at, of course you've looked at the uterus and how the fallopian tubes connect to the ovaries. It's like a horn, right?
Yeah.
So the ovaries will just be there because they're not technically really connected to anything but the fallopian tube. So they're not really gonna affect anything. They'll just be growing. And in some cases, like, they move around because the fallopian tube is like what? It's like a cord, right? So sometimes you go to the doctor and be like, oh, doctor, see, my stomach is getting big. And the doctor, if they're inexperienced, they'll touch that place. But because the tumor has moved,
Okay.
because it's basically like on a cord. It's like a cord swinging, like a ball swinging on a cord. It has moved, and the doctor will be like, "Oh, there's nothing wrong," and then it'll just continue growing. So, in the increased abdomen is the only telltale sign, and then when it gets too big, it starts pressing on other organs. So you start getting pressure symptoms like urgency to pee, or kind of pain in your abdomen, or you feel bloated. You'll just be feeling bloated all the time. You won't know, you feel full all the time, and you haven't eaten nothing. And yeah, those are really the only like telltale signs. Some women even think they're pregnant because maybe some of them, yeah,
how big can it be? Like, how big can it get?
Very big. It can become very big. No, like, I'm not even joking. Like, one of them, our teacher showed us one, and it was about like, it was like the size of a head.
Ooh.
It was very big, and they just keep growing. And because the ovaries are not connected to anything except the fallopian tube, you know.
Yeah, you mentioned that.
And yeah, apart from that, that's about it. And they can only really be detected by an ultrasound, or there's this thing in gynecology we call a bimanual exam. So two hands, one hand will kind of like be inside the vagina, and the other one is pressing on the abdomen. So it's like everything
is like a vaginal examination.
Yeah.
Okay.
And it's like pressing on the abdomen, so it's kind of like putting pressure from above and below where it can't move anymore. You kind of just get it into one spot and feel it. You have to either the ultrasound or the bimanual examination. And yeah, there's really no way to prevent it. It's genetics, and it's if you have a family history of breast cancer or uterine cancer, you should go get screened. And early detection is the best way to treat it. So when you go into your doctors for your yearly checkup, just be like, can you also check me for ovarian cancer? Or refer me to someone who can. Let me get an ultrasound, because these things will be growing inside you and you won't even know. Personally, I've experienced that. I had fibroids. Okay. I had about like 3 fibroids the size of onions just growing in my uterus. They were like 8 centimeters large. And because I never go for ultrasounds, I've never had an ultrasound, honestly, in my life. I was having the pressure symptoms, and they were just kind of, I couldn't, go use the bathroom. I couldn't urinate. I was having pain when I woke up in the morning, and I went there and they were like, you have tumors inside you. Did you know that? And I'm like, what do you mean I have tumors?
No.
Yeah, so I had to go get the fibroids removed. I had surgery and got the fibroids removed. But it was very eye-opening to me that I thought this thing was an old woman's disease, that something like this can be happening to a young woman like me, and I don't know. So now I'm spreading awareness so that other young women go get these tests, and they're very simple tests. An ultrasound is very cheap, very simple to do, and it can save your life. Honestly, it can.
Thank you so much for that. I'm so sorry about your experience.
Oh no, it's all right. Thank you.
So can we move to cervical cancer now before we talk about causes, symptoms, and prevention? Can we just move to cervical cancer?
Of course. So cervical cancer is another very tricky cancer that we see in gynecology. It was actually one of the most deadly cancers for women in previous centuries, because honestly there was nothing people could do. Once you get it, you're dead. Like, you just go just like that. So, and it's very easy to get, because the main or the number one cause of it is HPV, human papillomavirus, and it's sexually transmitted. You can get it from sexual transmission, is one of the ways. And once your partner has sex with someone who has HPV, the thing is, men are carriers. I don't believe that the symptoms show on them. Men are carriers. So once they carry it, your sexual partner can give it to you. And once it touches your cervix, that's it. HPV loves cervical tissue. It will find a home there. It will just burrow in there. It is very wicked. I don't even know how to. It's a very wicked disease. So, yeah.
Wow. Thank you very much. Thank you very much for that. Okay, so can we go to the causes, symptoms, and prevention? I know, like, ovarian cervical cancer, they hardly give symptoms. You can have it for like 15 to 20 years and you would know, right?
Yes.
So maybe you can just give us something else to notice, or something that could just be like hint or clue to us.
For cervical cancer, the other risk factors include like tobacco use and immunosuppression, and a lot of births. Like, when you give birth a lot, or have a lot of children, there are also risk factors for it, because high birth means high chances of infection also. For cervical cancer, the symptoms are more kind of there are more symptoms than ovarian cancer, of course, that you can use and know that, okay, this is cervical cancer. They're not as specific, but at least they are more. So if you start getting abnormal vaginal bleeding, because what happens is the tissue on your cervix is now very frail, because the HPV is kind of almost not eating into your cervix, but it's changing the tissue of your cervix. Now it's very weak and it's very frail. So when you have post-coital bleeding, that means bleeding after sex. So some girls, they like it rough, after the sex. I'm sorry.
No.
I'm sorry. After having sex, and the penis might hit your cervix, of course that will now cause the cervix to bleed, and now you're bleeding after sex. Exactly. And vaginal discharge. So you can have like abnormal vaginal discharge. You've done all the other tests. You don't have a yeast infection, you don't have BV. Like, what could it be? You should go get a test for maybe you have cervical cancer. In the later stages, the earlier stages can either be asymptomatic or you see symptoms like that, but in later stages you start having systemic symptoms like weakness, weight loss, anemia, things that are, so it's showing you that now it's affecting your entire body. And that's what I'm saying, like, it spreads. It does not stay in one place, and it's very scary. That's the word. Pelvic pain, abdominal pain, things like that, you should go in, and I'll let me also say the ways the doctors check for it. I'll stop there for now, but like after this, I'll show you the ways the doctors check for it.
Okay. All right. Thank you very much. That was super educative and eye-opening. Yes. Okay, you said you wanted to give us insight on something.
Yes. So for like cervical cancer, unlike ovarian cancer, it's not as easy to detect in like the cheapness of it and the quickness of detecting, right? For for cervical cancer, you need to first check if you have an HPV infection. So for that, you go for an HPV test, and then there's something called a pap smear that is not just testing for HPV, but it's also testing for precancerous lesions or squamous intraepithelial lesions. That's what it's called in gynecology. These are the lesions that are precursors to ovarian cancer, and if you can catch these lesions, like if you can catch them early, you can treat them. The treatment is kind of child, but if you can catch it and you can treat it as long as you are alive, eat healthy, work out, be healthy from within. Also make sure you have a lot of healthy foods, because of course what you eat and ingest will also affect how things are going down there. Next and most important thing is see your doctor regularly. Get these tests regularly, and an ultrasound once a year, a pap smear once a year. After for all women over the age of 21, you should be getting a pap smear and a HPV test once every year. There's also something called a colposcopy. It's like where they take a picture of your cervix. That you should get it if you see any irregular things in your pap smear. Like let's say you go get a pap smear and they find some stuff that shouldn't really be there, you should go get that. Other things like make sure your hormones are in check. A lot of women are walking around here with hormone imbalances. Their estrogen is too high or too low, or they have too high androgens, testosterone. Some don't even know they have endometriosis, PCOS. Also go get checked for that, because the estrogen and like too high estrogen can also lead to the growth of these tumors. They can lead to these cancers. Also the things we eat, like too much red meat. Depending on where you live, in a lot of these cows and red meat and stuff, they pump them full of hormones. So if you eat too much of those, they can affect your hormone levels as well. Make sure any other systemic diseases you have, maybe you have autoimmune disease or immunosuppressive diseases, you should also take care of those, because those can affect the bacteria or the bacteria fighting abilities or capabilities of your female reproductive system. And if it cannot fight those things, then it's easier for, let's say, the HPV to invade your cervix and other things. Like the ovarian cancer, unfortunately, there's really no way to prevent it. It's genetic. It's genetic, and you should just maybe talk to the other women in your family. Ask them, have you guys ever experienced this? If they have, the first thing you should do, go straight to your doctor. CCC, I have a history of ovarian cancer, breast cancer, uterine cancer in my family. I want to get a genetics test, because there are some genes that it's linked to. So test my genes, see if I'm a candidate for it, and then every year after that, you should go and keep check with your doctor. And For the cervical cancer, I say this all the time to women: do not take back your cheating man. Don't do it. It has nothing to do with morals or anything. It has everything, because HPV is linked not only to you having many sex partners, but also being with a high risk sex partner. So you can be a virgin and marry. If you marry the man who was a player in his day, he can give you HPV, because every single woman he has slept with, he's not bringing it to you. Every single HPV he has touched, he's not bringing it to you. So if your man cheats or is a high risk partner, he's that man that's had 300 bodies or something like that. I'm not one to slut shame. I'm not one to tell anybody what to do with their body. I'm just saying it from a medical standpoint. You shouldn't, or you wouldn't want to get with that man. Another thing I'll tell women, know your partners. I'm not against like casual sex, but if you're going to do it, be safe with it. Use a condom regularly, get tested immediately after with the people. Have your doctor on speed dial. If you see any like strange things like warts, or you feel pain, or irregular bleeding, just go straight to the doctor. Don't even say like, oh, maybe not. Just go straight. Yeah. And
Thank
that's
you.
really, yeah. You're welcome. You're very welcome.
Thank you very much. I enjoyed myself on this podcast and I learned so much. And my favorite takeaway, in fact, my favorite tip is the part where you said, practice safe sex and I don't have like too many
partners.
Then I think I need people to like listen to that part very well.
Exactly. It's a hard pill to swallow.
Stop encouraging sexual immorality, please. Not because anybody's a good girl or anybody's trying to form saints. No, it's for your own sexual health, please. Thank you very much. So like overall, I would just say regular gynecological checkups.
Yes.
Take care of your vulva and your vagina.
Yes.
Then keep a healthy lifestyle.
Yes.
Thank you very much. It was so nice having you on my show.
Thank you for having me.
Fun. I had so much girly time. I had so much. And I'm going to go out there to spread awareness right now.